So welcome back, everyone, after the break. We've heard a lot about the ebooks. I don't really know what I'm doing here because I think Mel and Andy have told you what I have to say. But really, it's just about the experience of co-editing these ebooks with Su Ming Ku, who is also present at this webinar and has been active in the chat. We were asked to do this as a result of a blog post I wrote. My editor at Policy Press read the blog post about methods that might be useful in a pandemic, including a lot of things we've heard about, like autoethnography and digital methods. And she asked if we'd like to edit a book. And we thought we stood a good chance of getting 15 decent contributions. We had no idea we were going to get over 100, but it was a great problem to have. And we got these ebooks out with amazing speed. I think between May and October, in 5 months flat, from the first idea to the books actually hitting the internet. And really, it's the quality of the contributions. And Vernon Gale is one of our authors, I'm delighted to say. He'll be speaking to you in a little while. But I just want to run through really some of the key ethical aspects that came up again and again and again from the chapters. And one of the first things was that this whole paternalistic idea of deciding who is and isn't vulnerable by researchers and ethics committees, which was already being questioned in the ethics literature, is now completely out of the window. Because in a global pandemic, everyone is vulnerable to illness, to bereavement, to anxiety, to isolation, obviously different degrees and levels. I'm not saying this absolutely makes everything equal, but everyone is vulnerable or potentially vulnerable, or if not vulnerable today, could be tomorrow or next week. Really, we're all vulnerable now. And that makes a real difference to ethical research and how we think about researchers and participants and well-being. Then there was a question that came up over and over again, and I think Mel and her colleagues also found this was an issue, which is it even okay for us to do our research now we've got a pandemic? Is it really even sensible to carry on or to start the project that we were planning? And this came up repeatedly. Then another ethical aspect, again, this has been mentioned, the digital divide. When we invited the chapters, Su Ming and I particularly asked for chapters from Indigenous researchers, from the Global South, from women, from marginalized researchers, and we got them, which was great. And what we learned, a lot of people were working digitally in a range of different ways with greater or lesser success, different degrees of success. And we learned the digital divide, we need a new name for it because it's not binary. Etevina Lovo was actually studying research ethics in Tonga. She's from Fiji. It's the same culture, or very similar. She was preparing to talk to Indigenous elders, and she knew how to do that. She knew how to greet them, what language, what to wear, what gift to bring, how to act. But then when she had to move online, the whole of her research became way more complex. It was already complicated, but other people from other countries have found this, that trying to work with Indigenous communities, in particular Indigenous elders online, is really difficult. Emmanuel Ndlovu was studying the impact of the pandemic, the socioeconomic and gendered impact, planned to use Skype, was working mostly with farmers in rural areas, but found that Skype really wouldn't work. They either didn't have it or they had it and didn't know how to use it, but they all had WhatsApp. Now, this was last summer, so, well, the middle of last year, so before the ethical problems with WhatsApp arose that we know about. But he found that it was very flexible. He could work asynchronously with his participants. They could respond through text or voice notes. If he wasn't clear about what they said, he could get back to them. So all these different ways people are finding to navigate the so-called digital divide. Natalia Reynoso and her colleague in Colombia doing research, again, around the pandemic, but trying to work with Indigenous communities in rural areas, which made real difficulty. There were connectivity problems, there were cultural gaps, there were generational gaps. We see that in non-Indigenous communities, the generational gaps with internet usage, but they're much more pronounced, as I understand it from the literature, when working with Indigenous communities. Very quickly, Nicola Jones and her colleagues working across the Middle East and North Africa, this was longitudinal research with adolescents. They switched to digital, but found that adolescent girls particularly struggled for privacy to respond to things online in their homes when they couldn't get out and nobody else could get out. So lots of need for flexibility, but there are also solutions Raphael Goldstein and his colleagues found that secondary data helped to fill a gap when they couldn't contact their participants, and the internet also helps.